Schizophrenia is one of the most terrifying psychiatric disorders. People suffering from this condition are about 14 times more likely to experience violence, endure severe side effects from medication, and face societal stigmatization. Today, we'll find out how a shattered mind can lead to a broken body. Schizophrenia is a severe mental disorder characterized by recurring episodes of psychosis, accompanied by a range of symptoms that can be roughly divided into positive and negative symptoms. Positive symptoms include incoherent or illogical thought processes, which can manifest as disorganized speech, delusions such as thinking one has exceptional abilities or is being persecuted, and the most distinctive symptom, auditory hallucinations, most often voices, which can range from friendly companions to vile commentators. The positive symptoms regularly cause the affected to fall into psychosis, a delusional state where distinguishing between what is real and what is not becomes difficult. Psychotic episodes tend to have a theme. In paranoid schizophrenia, religious or political delusions often occur. Negative symptoms involve disruptions to normal emotions and behavior, such as anhedonia, the inability to experience pleasure, affective flattening, so reduced expression of emotions, and avolition, a decreased motivation to initiate and sustain purposeful activities. These symptoms often progress in the chronic stage of the disease, between psychotic episodes. Schizophrenia can be divided into different subtypes in which the various positive and negative symptoms manifest differently. The condition is often associated with other mental disorders, such as substance use disorders, depression, and anxiety disorders. Cannabis in particular is known to be able to trigger an outbreak in many people who are vulnerable to this condition. However, genetic factors, childhood trauma, social status, and even being left-handed are other factors that increase the risk of developing schizophrenia. There seems to be a kind of make or break effect with schizophrenia, where people have an innate vulnerability to the disease and stress in form of drugs or psychological trauma is added. At a certain point, the disease breaks out. Diagnosis is made through psychiatric examination, as there is no diagnostic test for schizophrenia. An MRI of the brain will show no difference from a healthy person. Schizophrenia is a chronic disease and medication aims to control the symptoms and slow the process. To this day, no cure has been found. Schizophrenics die on average 15 to 20 years earlier than the general population. Psychotic episodes cause the affected person to lose their grip on reality. Depending on the situation, the theme of the psychosis, and the character of the auditory hallucinations, people suffering from a psychotic episode may have a high risk of suicide. Due to the high comorbidity with other psychiatric disorders and the general quality of life impairment that accompany the condition, the risk of suicide remains high, even in non-psychotic individuals. In the early 1950s, the development of a new type of medication changed the treatment of people with schizophrenia forever. Neuroleptics are so-called dopamine antagonists. Hyperactivity of dopamine transmission, especially in the mesolimbic pathway of the brain, is associated with positive symptoms like hallucinations and delusions. Dopamine antagonists bind to dopamine D2 receptors without activating them, effectively blocking dopamine from binding to these receptors. However, this has severe side effects. Dopamine antagonists, like haloperidol, also partially block serotonin receptors in the brain, which are involved in regulating appetite and metabolic processes. This can lead to excessive weight gain, diabetes, and an increased risk of cardiovascular death in many patients. Dopamine itself is also a crucial neurotransmitter of the brain. The basal ganglia are structures located deep in the brain that help to coordinate our motor functions. They are responsible for smoothing out our movements and coordination. If their chemical balance is disrupted by dopamine-blocking medication, symptoms like tremors, sudden tics, and rigidity of muscles can occur. These so-called extrapyramidal symptoms are the same symptoms a patient with Parkinson's disease would have, since in Parkinson's, the dopamine balance of the basal ganglia is also disrupted just not by medication, but by degeneration of the brain itself. Switching from a state of psychosis to that of an advanced Parkinson's patient may not be a particularly pleasant experience. These effects can also suddenly start to appear even years after stopping neuroleptic medication as a so-called tardive dyskinesia. Neuroleptics affect the heart's electrical conduction system as well, leading to a higher risk of cardiac arrhythmias and sudden cardiac death. Modern neuroleptics aim to reduce these side effects. However, they remain a high-risk drug with many side effects that can significantly lower one's life expectancy and quality of life. Nevertheless, they have changed the field of psychiatry and the lives of people suffering from schizophrenia forever. Before the invention of neuroleptics, the fate of many individuals with schizophrenia was to spend the rest of their lives in a closed asylum. Schizophrenics often face unemployment and poverty. The disease is still heavily stigmatized in our society, and side effects from neuroleptics, the need for regular psychiatric treatment, and progressing negative symptoms often make it hard for the affected to find and hold a job. This can limit access to healthy food, safe housing, and medical care. Due to the progressing negative symptoms, people with schizophrenia often have a different awareness of their own health. They will, on average, obtain healthcare later or not at all. On the other hand, they often face disengagement and poor treatment from health services. The treatment they receive is typically less intensive compared to that of the general population. As we've learned today, schizophrenics face not only the internal battle of psychosis and side effects from medication, but also societal stigmatization and inadequate healthcare support. Despite these daunting obstacles, it's crucial to remember that a diagnosis of schizophrenia does not mean a life sentence of isolation or suffering. While it's true that individuals with schizophrenia have a 3 times higher risk of premature death, it's equally true that they can lead fulfilling normal lives. With the right combination of medication, therapy and understanding, people with schizophrenia can overcome these barriers. Support from family, healthcare professionals and the wider community is vital. Thank you for watching Forensic Archives. If you found this video informative, please give it a thumbs up and subscribe for future content.